Hospitals in India, many cities there, are overwhelmed with patients. Oxygen supplies are scarce. Patient beds are maxed out. Sometimes people are just on the floor. Vaccine doses limited. And according to the World Health Organization, India actually accounted for nearly half of all coronavirus cases reported globally last week. India is averaging well over 3,000 deaths per day. Some people think it could be 10 times that. The country's crematoriums are overflowing with COVID victims. Funeral pyres burning through the night. You see them there. So much so that wood stocks in New Delhi are running low. And the crisis is leading to calls for a global response. The Canadian government put up $10 million in support for the Canadian Red Cross, which is supporting India in its procurement of essential supplies and medicines. And today it is sending antiviral medication and ventilators to the country. And that gives us a good opportunity to talk to Karina Gould, the Minister of International Development. She is in Burlington, Ontario. Minister Gould, thank you very much for taking some time this afternoon. And I just want to go quickly to these scenes that we saw of all these supplies being loaded on a military aircraft, sent off, now on its way to India. Is this everything that Canada could fit on that plane, or everything that Canada could spare, or are there more planes with more equipment and more supplies heading to India?
Yeah, so this is the first plane. Today we sent 25,000 vials of remdesivir and 50 ventilators. We will be sending another 300 ventilators over the coming week to India. And we also are supporting the work that UNICEF is doing in providing over 1,400 oxygen concentrators in India right now. So this is what Canadian, what we have an excess of our national emergency stockpile, and is in response to the needs of the government of India.
How much more can we spare? Because 50 or 100, however many ventilators, is really a very small drop in the ocean of requirement in India. How much more can we spare?
Well, as you know, Canada is not the only country that's providing support to India right now. This is a global response. And so, as I said, we'll be providing another 300 ventilators in the next week. But, right now, everything counts in India. And those 1,400 additional oxygen concentrators are really important as well, that are being provided through UNICEF from support from Canada. We, are doing what we can. We've assessed what we have available in our stockpile and are sending what we can to be part of the response. And as you mentioned, it is a really difficult time in India right now, and Canada is doing what we can to support our friends and partners in India.
For many countries, Canada and India included, vaccines are the way ultimately out of this. India has been actively pushing for a patent waiver on COVID-19 vaccines so that they essentially would be able to produce vaccines. They produce some of them in India already, but they don't, for instance, have the Pfizer-BioNTech, something we're benefiting from here. They don't have the ability or the right to produce it there. And so there's a push to sort of have a waiver on those patents. We have some breaking news today that just this afternoon, the United States trade representative indicating that the U.S. would support suspending those patents for this emergency period. The WHO calling it a major milestone, but Canada's still sort of holding out on its support. Why is that?
Well, Canada has been open to this conversation and finding solutions from the very beginning. I welcome this move from the United States. It, I think, is a really important step in this conversation. They're looking to have this conversation at the WTO. We have been trying to broker this conversation for many months now at the WTO to find a path forward. And so we very much welcome this move by the WTO and hope that it brings both sides closer together, because ultimately what we all want is to be able to ensure enough vaccines for everyone right around the world.
Okay, but so Canada has not as yet actually said we support patent waivers. And if I go back to something the Prime Minister signed, he said, we call on global leaders to commit to contributing an equitable distribution of the COVID-19 vaccine based on the spirit of a greater freedom for all. Prime Minister Trudeau signing that declaration before any of us had vaccines. Now that we do, Canada not yet actually saying what the U.S. has now said, we support patent waivers. Is Canada ready to do that now?
Well, as you'll probably recall, I mean, the Prime Minister said if we discover the vaccine in Canada this time last year, we would share the recipe with the world. So Canada has a track record in this. We did that with Ebola. This has been a very long conversation at the WTO. As I said, we have been open to it. We have been constructive and trying to find solutions in terms of moving forward. And what we hope for is that with, the US's move today, that we're going to bring, both sides of this conversation closer together so that we can increase vaccine production and make sure that we're producing enough vaccines for the whole world.
I'm still left a bit puzzled about whether Canada supports a patent waiver or not. I hear you saying you support the idea of sharing and equitable access. What I don't hear is Canada, a representative of this government, saying what the United States said today, something that the WHO calls a major milestone, and saying, we support this, let's get it done.
Well, so we still have to see the text that all of this has to be negotiated at the WTO. As I said, we have been constructive actors in this space over the past year. We welcome this move by the United States, and we will continue to be a constructive partner at the WTO and hopefully be able to reach a consensus on the path forward.
All right. Karina Gould, Minister of International Development, on the day that Canada sends a plane load of supplies to help out India. Thank you very much.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.